Hi, my name's Toby Hammond. I'm a consultant surgeon and I have a specialist practice in groin and abdominal hernias, as well as certain bowel-related conditions. So if your GP thinks that you have a hernia, then what they'll do is they'll refer you to the hospital to see a surgeon such as myself. We will then talk to you about the symptoms that you're experiencing. We'll talk to you about if you have any other medical conditions, any regular medications, allergies, what you do for a living, what your hobbies are. And once we've got all that information about you, we'll then examine you, confirm that you have a hernia, what kind of hernia it is, and then we can guide you as to what the right management options are for that hernia. So if you've got a groin hernia, the options are to either not have it treated and to stay as you are, which can be an option in a select few patients. The alternative, and one which most patients choose, and is in the majority of cases the right course of action, is to have an operation. The operation can be carried out by what's known as an open technique or via keyhole surgery. An open technique means making an incision over the groin area where the hernia is, whereas keyhole surgery involves making an incision around the belly button and two smaller incisions on either side. And there are two different ways in which a keyhole operation can be carried out, one known as a TEP approach and one known as a TAP approach. But in terms of which has better outcomes, they're pretty similar in all fairness. So generally, whichever technique the surgeon is most comfortable with and is most used to doing, or they feel that you're most suited to, will be what they recommend. Whenever we repair a hernia, whether it's keyhole or open, the, philosophy behind doing it involves reducing the hernia, so bringing the hernia contents back to where they belong, then repairing the defect through which the hernia has come through, and then reinforcing that repair with a mesh. And a mesh is a type of, it's like a medical grade plastic material that allows the ingrowth of scar tissue to strengthen the area to reduce the hernia coming back. I do appreciate there's been a lot of negative press in some respects around the use of mesh, but there are international guidelines that were published in 2018 which really do demonstrate that mesh repair is the best way to fix a groin hernia, and it's safe. So in terms of the operation, depending on whether you're having what's called the open operation, which is when you have the incision over the groin, or you have keyhole surgery, there are different ways in which it could be carried out in terms of the anaesthetic. So if you have keyhole surgery, you have to have a general anaesthetic, which means you're put to sleep. If you're having an open operation, then you've got a few more options. You can be asleep, have a general anaesthetic, you can have a local anaesthetic, or you can have, which is where they inject around the groin to numb the skin, or you can have something called a regional anaesthetic, which is where they put an injection into the back and they numb you from the waist down. There are advantages and disadvantages to both approaches. Local anaesthetics are really, really good operation for someone that has other medical conditions that might make it more dangerous for them to have a general anaesthetic. For the more elderly population, who are more susceptible to the effects of a general anaesthetic. And you tend to find that if you have a local anaesthetic, you're up on your feet quicker, there's less post-operative pain, there's less risk of other complications that can occur than if you had it under a general. Although I would say that general anaesthetic is a perfectly safe way to have the operation, and it's a really good way. So you don't have to have a local anaesthetic at all. There are just different ways of doing it, and it's worth discussing that with your surgeon. However the operation is done, be it general anaesthetic, regional anaesthetic, or local, most patients will come in and go home on the same day as the operation. The operation itself should not take any longer than about an hour, and often a lot less than that. Once you get home, yeah, it's going to be a bit sore, you've had an operation, but not too sore. And realistically speaking, you should be able to manage the pain with simple painkillers such as paracetamol and ibuprofen. They do slightly vary according to whether you've had an open approach or a keyhole approach. Following the operation, it is going to be a bit sore. However, about 10 to 12% of patients can get what's called chronic groin pain. That's long-term pain in the groin. And in a small proportion of that, it can be really quite severe. You can get groin numbness, you can get groin swelling, you can get bruising. A proportion of patients' hernias will come back, and around 5% of patients may need further surgery for a hernia that's come back. There is a risk of not being able to pass urine afterwards, and that's called urine retention. That can mean you need to pass a catheter, a tube, into the bladder to help you pass urine. Much more common in men than in women. There is a risk of injury to the blood supply to the testicle. It's pretty rare for that to happen, but if it does happen, it can mean that you get shrinkage of the testicle and loss of function of that testicle. As I said, it's really quite rare. That shouldn't affect your sexual function at all though. In women, there is a slight risk of injury to the nerve that supplies the labia, which can mean you can get some numbness, some hypersensitivity, or some pain there. Again, that's really rare. Another rare complication, more so with keyhole than open, but again, it's still pretty rare, is injury to the bowel, the bladder, or a major blood vessel that can mean the need for further emergency surgery. In any operation, there's a risk of getting a blood clot in the legs, a deep vein thrombosis that can potentially travel to the lung, known as a pulmonary embolus. When keyhole surgery is carried out, because we have to make an incision at the umbilicus, the belly button, that can cause an area of weakness, which means again there is a small chance of developing a hernia at that site. If you think you've got a hernia, please go and see your local GP. They will assess you, and if appropriate, they will refer you on to see a surgeon such as myself. If you want more information about hernias in general, I strongly recommend you go to the British Hernia Society website. They've got loads of information there for patients about different types of hernias and different treatment options. There's also the European Hernia Society website, which actually has a section called Guidelines, and it talks about all different types of hernias with all the international and national guidelines for how to treat different types of hernias.